causes for dysfunction. There's not an all-inclusive list, just a brainstorming list. But the posture we already talked about, gravity, any sort of injury, even childhood injury, you don't know how you healed or progressed, especially, we didn't really go to therapy as a kid. We didn't go to rehab as a kid when we had an injury. So maybe not really healing the best way or coming out of it in the best way and carrying those less optimal movement patterns with us our whole life. Trauma, having a child, whether it's a vaginal delivery or a C-section, there's a lot of trauma to the pelvic floor. And then a motor vehicle accident, any sort of sexual trauma, or just any type of injury. Breath holding and straining. So a lot of times, so the pelvic floor muscles, we've got our vaginal opening and our anus. These are all the pelvic floor muscles. So our pelvic floor is coordinating our bladder and our bowel. So if we're constipated and we're constantly straining to have a bowel movement, that's downward pressure on this system. So that could be part of the cause for our urinary incontinence or for our pelvic pain. So being able to manage the bowels to have better pelvic floor health can help with whatever other symptoms that you may be having. And there's a lot of different, like constipation, there's a whole subset. We could talk about posture to release the tension of the pelvic floor muscles, breathing patterns, diet. So just general bad habits. We're not taught how we're supposed to pee. I mean, we just kind of figured it out, right? So you can void by lengthening your pelvic floor muscles and taking the pressure off the urethra and letting the urine come out, which is what you should do. And that's what we'll kind of break out and learn how to connect with those pelvic floor muscles and lengthen them. But some people override that and they use their abdominal pressure. I used to do that all the time until I learned that I was supposed to do that. I didn't have enough time to go to the bathroom, so I was in a hurry and I would push it out. And all that constant downward force is putting me at risk for prolapse. Just general decreased awareness and understanding. So good for you guys for being here. Hormonal changes. So people don't really talk about the hormonal changes that happen with a hysterectomy or with menopause. They know it happens, but how far does it really reach? And being able to start to plan for that and bring it into your plan of care. Anxiety, stress, emotions, our pelvic floor is responsive to all those things. So our pelvic floor will tighten up if we are anxious, if we're stressed out, if we have a trauma in our history, maybe even if we're not even aware that, like emotionally, maybe we're not so conscious of it, or maybe we've worked it through and we're okay with it, but our pelvic floor has not let go of it. So there's been a lot of emotional release that people weren't aware of when dealing with pelvic floor tightness. And then high intensity sports. So again, people are pushing themselves to their max, they're holding their breath, they're trying to get there. They're probably crunching and bracing, and they're not really doing themselves a service. They're also probably not using their system to their max performance. And then, neuromuscular disorders, and then GI dysfunction we kind of talked about already.